p.m. here in Seoul. I'm Devin Whiting at the News Center, and we're breaking into our regular programming to bring you the latest briefing from the South Korean health authorities. We have interpretation for you in English that should start any moment now. In the meantime, some updates. On Wednesday, South Korea reported another 242 cases of COVID-19, bringing the number of confirmed cases to 7,755. 6 more deaths were reported, raising the death toll to 61. Of the latest cases, 131 were reported in Daegu and 18 in Gyeongsang-Bukdo Province. Seoul saw 52 new cases from a cluster infection at a call center. With 41 more people released from quarantine, 288 have recovered. Around 18,500 people are currently being tested. Now, the call center in Seoul is now linked to at least 90 cases. That's up from the 60 that were being reported on Tuesday. It's the largest number of people to have been infected in a single place in Seoul, raising concerns about cluster infections in the capital. Mayor Park Won-soon says the city is urging private call centers in the city to close as a preventative measure. There are 417 such call centers in Seoul. 2 of the cases from the call center are followers of the Shincheonji religious group, which has been at the center of South Korea's outbreak. The Seoul Metropolitan Fire and Disaster Headquarters. We're getting word that the briefing is starting. Let's listen in.
Let us now begin our regular briefing for March 11th, Wednesday. As of midnight today, the total number of COVID-19 confirmed cases stands at 7,755. Of them, 288 have been discharged following full recovery. And yesterday, we saw an increase in the confirmed cases by 242. And a total of 60 people have died so far. And regional distribution of confirmed cases is as follows. Still, we see nearly 90% of the cases concentrated in Daegu and Gyeongbuk Province. And yesterday, we also witnessed a cluster infection in Seoul at the Gurogu District Call Center. And we have thus witnessed an increase in the confirmed cases in Seoul and the Gyeonggi-do Province. And about 80% of the confirmed cases were related to cluster infection. And there were also sporadic infections, about 19 of them. And in relation to the cluster of infection, about 97% are related to Shincheonji. And regarding the Gurogu District Call Center, from March 9th until now, we saw a confirmed case of 90 people. And we are currently carrying out epidemiological investigation behind these cases. And there are, of these 90 cases, 77 were the employees of the call centers, and 13 are those who have come in contact with these confirmed cases. And we see that this number is subject to increase in the near future. And of the 77 people, we found out that all of them have worked on the 11th floor. And there are also people who are working at the 7th and the 9th floor. They amount to about 500, and they have been self-quarantined. And we will also investigate into their cases as well. And KCDC believes that such cluster infections are increasing, and in particular, 20 cases were infected at medical hospitals, and it was followed by multi-use and religious clusters, as well as long-term care centers like nursing homes. Especially when there is close contact in a closed-door situation, the infection risk is higher. So therefore, for these businesses which are more vulnerable to infections, for these businesses, we urge them that they go over their environment. So it is most advisable if they could advise their workers to go on telework if it's possible. And within the business offices, it is also urged to distance their desks so that they can sit far away from each other. And it's also advisable to wipe the surfaces of their desks and the other facilities that are located. And also having hand sanitizers is of utmost importance treatments and having regular ventilation, as well as checking their body temperature and checking their symptoms of respiratory symptoms is also very important. And we also advise them to report their health monitoring conditions to the KCDC. And KCDC also believes that based on these structures, we will be publishing a guideline which will be distributed to all of these businesses and local municipalities. And KCDC, in the case of countries where a cluster infection has increased, we are going to designate Italy and Iran, or actually we have designated Iran and Italy as special care zones. So those who are flying in from these countries need to go through a special quarantine and screening, and they need to download these self-diagnostic medical applications so that they could report their conditions to us on a daily basis. And for those who come in to Korea from these countries, their personal information will be handed over to our authorities under the program of DUR. And the KCDC is also closely cooperating with the Korean Psychological Association, and we are helping with the mental consultations. And so far, we have saw an increase of calls to the call center 1339 regarding their psychological health. And to this, we have garnered 230 experts who volunteered to consult with these people who are calling for consultations. Moreover, so far, the Ministry of Welfare also has a COVID-19 Comprehensive Psychological Support Center. So if you need assistance, you can also take use of this service. And in order to prevent the further spread of the virus, KCDC believes that it's of utmost importance to comply with personal sanitary practices and have social distancing. As we have re-elaborated, the COVID-19 has great spread and it's very contagious in the early stages. So it is very important to comply with personal sanitary practices. In order to prevent the spread of the virus through droplets, it is advisable to have 2-meter distance when you come in contact with others. And it's also important to wear face masks if you have any symptoms of cough and fever. And if the droplets are on the surface and are polluted on the surface, the contact through the surface could also be infectious. And in this case, it's most important to wash your hands thoroughly with soap and water. And please refrain from touching your face with these dirty hands. And it is also advisable to wash the surface of the things that you touch on a daily basis. Moreover, if you have fever or respiratory symptoms, do refrain from going to school or work and stay at home and monitor your conditions for the next 3 to 4 days. If you do not see enhanced symptoms, it is advisable that you visit the screening center. Thank you very much.
All right, and that'll conclude our coverage of this briefing. We'll have updates later on all that information, plus some in-depth analysis. Stay tuned to Arirang News for all the latest. We'll be back at the top of the hour.